Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's show, first off, Pam Beasley from The Office, better known as Jenna Fischer, just came out and said that she has breast cancer, but she's cured. But there's some interesting things about it, and we're going to talk about that. And then, Hidradenitis Suppurativa. You probably have never heard of this, but you might like this segment because it's going to be pretty interesting. And then finally, what plastic surgeries might be covered by insurance? I'm going to go through them all, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Oh, welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. Turn on those notifications. It helps us so much. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me is the wonderful Sarah.
Hi.
I love her outfit today. She looks great.
Oh, thanks.
In the box, we got Travis. How are you, buddy?
I'm good. How about?
I'm good. How about you?
I'm doing good, man.
I'm
doing
good.
good. I heard you laughing about the hidradenitis. Like, what were
Yeah.
you thinking, like, how that might be
I
pronounced?
was putting it in the system, and I was like, "How on earth do you pronounce this?" And then you just said it with no effort at all, no
It
trouble.
only took me 8 years of surgery training to get it right. The first 5 years, I was totally butchering it,
It's like
but
doctor language.
I know
Yeah,
it's
for
totally
sure.
doctor
Great
language,
job.
but- Hey, I was telling Travis this before we started the show, Sarah. You know, 30 days ago, we hit 2,000 subscribers.
Okay.
In the last 30 days, we've gained 1,100.
Whoa.
Pretty crazy, right? Like,
So what are we at now?
3,100 and change for YouTube. I don't know about the other platforms. I probably should know that, but yeah, thank you guys so much. Any of you new subscribers and old subscribers, we really do appreciate it. Also, if you're watching live, please leave us a comment. We love for people to jump in the conversation. But
100%.
hey, before we jump into segments, did you guys happen to see the Tesla thing last night?
I saw like pieces of it on social media, like
What
the.
happened?
So Tesla had this big event. I didn't know it was coming up, but I was working on the show, right? And of course I got my computer with all my monitors and stuff, and I had X up there and it said Elon was going live. And so I'm always up for watching Elon talk live. I think it's kind of entertaining. And he was doing this big presentation with Tesla about the robo-taxis, which I didn't even know this was like something coming out, which was cool. Like the robo-taxis are pretty cool.
I heard on a podcast. That
Yeah.
They were like the states that were approved to use these robotic cars.
Yeah, Texas and California are some of the first ones. So get a load of this. I think
People
this is
are
cool
pissed
about
about it.
like the robo-taxis wasn't even the coolest thing of it, but like there was something cool about the robo-taxi. It's like a car, you buy it, right? And so you drive it to work, and instead of parking it, like it's autonomous, you just kind of send it off on its way and it acts like an Uber. And so you make money with it while you're at work, and you say, all right, be back at 3 o'clock to pick me up, and then the car comes back. Isn't that crazy? That's like some next level stuff, right?
That is insane.
And it's like they're supposed
it
to be
drives
like-
itself.
Yeah, they're supposed to be less than 30,000. Yeah, you could buy like a fleet of these things, just have them out there like run around being Ubers.
I also
Yeah.
saw like the robots.
Dude, okay, so
Yeah,
that's
I
what
saw
I was.
the robots,
That's what I
too.
was super
Saw
psyched about. I mean,
I saw a video of 2 Chainz. Yeah.
what?
The rapper. What's his name? 2 Chainz or
Probably
something?
so.
I don't know,
There's a rapper named 2 Chainz, so it could be.
Yeah, it was him, and he was talking to the robot.
dude. Those robots are freaking wild. Like I knew they were working on them, but man, you know, I mean, they still kind of move like a robot, but like they're pretty darn good. And yeah, that's pretty amazing. They're gonna sell these things. They're supposed to be between 20 and 30 grand, but like you can have this robot like go shopping for you, or you know, chop a tree down, or build a fence, or watch your kids, or entertain your grandpa. I mean, it's pretty wild stuff, man. Like that's like some next level future stuff that they're coming up with.
That's like iRobot.
I know they look like iRobot, and so I tell Cindy was doing something else, and so I actually got up and I was like, you should see this thing on X right now, and I started talking about the robots, and so the first thing she says, can you just tell it to go kill someone?
Oh no.
I was like, no, I don't
Oh,
think
God.
so. It probably has some guardrails,
Security
for murder,
features,
I would
right?
think.
Yeah.
But anyway, yeah, interesting
That is
world we live in right now.
Insane.
Yeah, pretty crazy. So, all right, let's move on to some segments. All right, any of you guys watch The Office?
Yeah. And if you don't, you're weird.
Okay, cool. I didn't know if you guys watched The Office. Trey, have you watched it?
I do not watch that.
Oh, you have?
my
Dude, you should
gosh.
totally go back and watch it. Like it's, it's funny. Like I feel like Seinfeld and The Office are, I mean, they're both sitcoms, right? But they were like super iconic. And I didn't watch Seinfeld when it was a real show. Like I was too cool to watch Seinfeld because everyone was talking about it, and I was like, I'm not gonna watch that crap.
Yeah,
But then,
his voice kind of annoys me though.
yeah, okay, I can get behind that. But I just didn't watch it out of principle because it's like the '90s, right? You're supposed to hate everything, so of course I hated Seinfeld. And anyway, so I went back and watched it. And Trey, you should be like me in Seinfeld. Go back and watch it. That show is like pretty good, I think.
Okay, I may have to binge watch.
It's like one of those things where
First, he needs to watch The Office though.
Yeah, that's what I meant. I didn't mean Seinfeld. I meant The
Yeah.
Office. Yeah, totally The Office.
Yeah,
Seinfeld's getting a little dated. We still watch the reruns, but
Yeah.
all right. Okay, after I successfully derailed my own conversation. So The Office. So one of the most beloved characters on there was Pam. Her
Pam
real name
Beasley.
is Pam Beasley's real name, Jenna Fisher.
You
Well,
know, she has a podcast too with
dude, you know what's crazy?
what's her name? What's her name?
Angela.
Angela. Yeah.
That girl and I were at Baylor at the same time. Angela Kingsley.
Oh yeah.
Yeah, I'm trying to remember if she was a year ahead of me.
She's from Texas.
I don't know where she's from, but I know she went to Baylor,
Baylor.
and she was in a sorority that that we hung out with. I don't remember, which doesn't mean a lot. But yeah, I actually went through some of my old books to see if or pictures to see if I had like a random picture of what's her name on the show. Angela, yeah. And
Yeah.
I couldn't. I looked through all my old photos.
That is cool.
Anyway, so Jennifer, God, I keep derailing this. We're never gonna get through this segment. So Jenna Fisher is Pam. She actually had this huge announcement just a couple days ago on Instagram that she had breast cancer.
She
And
just didn't tell anybody about it.
she didn't tell anybody. Well, she didn't go public with it. I
Yeah.
mean, people, obviously some people knew her family and friends and stuff. But now she is cancer-free, and I want to kind of talk about it because there's a couple things I was just going to, you could do 50 segments about breast cancer, but there was a couple things that specifically she talked about that I thought was interesting. So kind of her story. So back in October 2023, she actually posted on Instagram about getting her mammogram. I threw it up there because it's kind of funny because there's an Office episode where Michael Scott talks about ticking time bags, and she's like, I get my ticking time. I remember when that came out because my wife, I think, said it to me and we were laughing about it. So she went to get this mammogram in October of last year, and the mammogram didn't really show anything specific, but it was deemed inconclusive because she had really dense breast tissue, and her doctor recommended that she go get an ultrasound. So she went and got her ultrasound, and they actually saw something on the ultrasound in her left breast. They got a biopsy, and it ended up coming back as cancer. Now, she didn't mention if it was ductal or lobular, but she mentioned that it was a stage 1 triple positive cancer. So she underwent lumpectomy, chemotherapy. So lumpectomy, for those who aren't familiar with the breast cancer treatments, usually the main big option is mastectomy, where you remove the entire breast, or you do lumpectomy plus radiation.
Okay.
And then chemotherapy is always a plus or minus for those things. So she opted for lumpectomy and radiation. She did have chemotherapy, and in her post that she made, and I got a couple clips of that, just throw it up, Charles, if somebody wants to like pause the video and take a look at this. It kind of talks about her story, and I didn't put them all up there. She had a couple more, but this was kind of the gist of her story. She is now cancer-free, which is fantastic. And so, as I said, we could do 100 segments on breast cancer and not cover everything.
Yeah.
But there was a few things in here that I thought were worth mentioning, or a few things that we would focus on. And so, the first thing, and she mentioned this herself in her post, is get your mammograms.
Yes.
It is so important. Breast cancer is absolutely a curable disease, as we have seen with Jenna Fischer, but you have to catch it early.
Yeah, my grandma had it when she was elderly, and she beat it.
Was she getting her mammograms?
But only because my mom was making her, because my mom's
Really?
a nurse. Yeah.
Wow, so that's so good that your mom did that, you
Yeah.
know, because if she, had waited too long, then, the outcome may not have been the same.
My grandma just sliced it off,
Just
but
in
because she was old
Yeah.
enough where
Yeah,
it didn't matter.
She wasn't as interested.
She wasn't.
Yeah.
She didn't care about that stuff.
So there's actually research out there to back that up, and I'm gonna throw up a study. Throw the next slide, Travis, if you would. So if you want to look at the data about that I'm fixing to mention, basically the gist of this is those women who get annual mammograms have a 40% decreased mortality rate when it comes to breast cancer versus those that don't.
Yeah.
And that's a big number. I mean, it's not like 5%, it's not like 10%, it's like 40%. That's a huge decrease.
Yeah.
So get your mammograms. I know it's a pain, but you got to do it because it can absolutely save your life. So that's the first thing I wanted to talk about. Second, I want to talk about, she mentioned she had stage 1 triple positive breast cancer. Mm-hmm. And so I think a lot of people don't know what that means. You know, there's a lot of, terms there that I think are fairly nebulous. I mean, I'm assuming you guys have heard of cancer stages, right? Like that's at least a
Just stages, yeah.
Yeah. Absolutely.
Yeah, okay. And then triple positives, that ring a bell? Okay. Trey,
Nah.
have you heard that one?
No, I've not heard that
Okay,
one before.
all right. So, I mean, once again, we could go into like a ton of detail on this, and I don't want to like lose people with like super technical talks. I want to kind of give like an overview of these things. So, stage, as you guys probably have realized, involves looking at how far the cancer has gone, and it helps people come up with both treatments and prognosis. And so, for breast cancer, it's stage 0 through 4. So stage 0 is basically non-invasive cancer. So what that means is the cancer cells are literally right where they started. They haven't gotten into any of the surrounding tissue. So stage 0 is great. As we call that, like basically, in situ carcinoma, which means it's just where it started. It hasn't not gone like throughout the body, but it hasn't even gone like next door to the normal breast tissue.
Yeah, so you wouldn't be able to feel that type of cancer.
No, absolutely
Yeah.
not. Yeah, absolutely not.
You'd only be able to detect it in a mammogram.
Correct. Yeah, you can actually detect stage 0s. Like there are certain things on a mammogram or MRI or ultrasound that would show that.
I got a good question for you later when you finish.
Bring
all
it.
that.
No, do you want to do it now? Do you want to do it now, or do you want to wait?
I don't care. No, like whenever I go to like my lady doctor and they do like they perform like a breast exam.
Yeah.
And I'm always like, I wonder how, like if it's like if they can feel it more if there is something or less because I have implants. Like if that affects like how they can, like how like a doctor can detect that, like just doing like a regular breast exam.
I think that depends. There are some studies out there that show that it might be easier to detect cancers with mammograms when you have implants because it pushes your breast tissue forward. Mm-hmm. Of course, you do have to tell them that you have implants because they take separate views. They're different views. They're called Elkland views on the mammogram. I'm not sure there's a lot of data to support that a breast implant would help you with detecting a cancer by self-breast exam or doctor breast exam.
Yeah.
I think it's a good idea for women to do self-breast exams periodically. But, I mean, being quite frank, I think if you're getting your mammograms, like that's much, much, much more important.
Yeah.
I mean, a cancer has to be a decent size for you to be able to feel it. Like you're not going to feel like a 0.5 centimeter cancer or a 1 centimeter cancer.
Yeah.
It has to be bigger. And you want to catch cancers when they're, millimeters big, not centimeters big.
Right.
And so it is a great idea to do breast exams. I think that there was actually a study that came out that said that there was no real difference in cancer detection for women that did self-breast exams versus didn't. Don't hold me to that, but I want to say that there is a study out there that says that. Mm-hmm. Even if that's true, I still would do it. But more important than that by a factor of 10 is to get your mammograms. Yeah. Because they'll detect it much sooner.
And that doesn't start till you're 40?
Man, we just did a segment on this. I want to say the new one was it 40 or 35?
Well, I'm 35 now. I just turned 35.
They just changed it. No, I think it went to 40. I think it went to 40 from like older. Okay. Yeah, I'm pretty sure it went to 40. Man, I should know this, but like I'm not the one that refers women for mammograms. Like as a routine thing. Like we do it when we do certain surgeries, but I think the latest data it went to 40. But I will double check that and I'll let you know next week.
Okay.
All right, going back to stage. So stage 0 is non-invasive. So stage 1 is what she had. And this is where stages get a little confusing because there's like stage 1A and 1B, and I don't want to get that far into it. But basically the gist of it is stage 1 is either a very, very small tumor with maybe like one lymph node or just a small tumor with no lymph nodes. And by lymph nodes, I mean the cancer has gone not only just into the surrounding tissue, but it's gotten into the lymph node system, which generally is a bad thing. You don't want cancer to get to your lymph nodes. It's not like an end of the world problem, but it's not good.
And if you breastfeed, you have a less chance of getting lymph whatever type breast cancer, right?
There is data that shows that breastfeeding, I think, having
helps deter
it. Yeah, it helps decrease it. I can't remember. Man, I really should brush up on that. because you're asking great questions. I don't want to say the wrong thing, but I do want to say that breastfeeding decreases risk to some degree.
So I will say this: you were right. 40 is the starting
40?
age that you should start
Nice.
to get a mammogram. Is what they
Excellent.
say.
Yeah.
Yeah.
Good. Well, I'm glad I remembered. So stage 2 would be a larger tumor with some nodes, or a very, very large tumor. Stage 3 would be a very large tumor with many nodes, and stage 4 is the worst. That's where it's metastatic, meaning not only is it in the breast and the lymph nodes, but it's gone to another organ. So that's obviously the worst. Yeah.
What's
So
the first organ it goes to?
Your
Your lungs?
It can go to lungs, liver, brain.
Thyroid?
When breast cancer spreads, it's not a good thing. There are certain cancers that can spread where you can really still treat it very, very well. Things like prostate cancer is one.
Yeah.
Breast cancer, definitely you want to catch it before it gets to stage 4. So she mentioned that it was triple positive. So this is going to be slightly detailed, but I'm going to kind of make it as simple as I can. When they talk about positive or negative tumors, they're talking about 3 things: estrogen receptor, progesterone receptor, and HER2. And basically, these are receptors on the breast tissue that affect growth.
Okay.
And so if you have estrogen receptors, progesterone receptors, or HER2 receptors, those hormones can bind to the breast tissue to cause it to grow. And so they sometimes will say that a triple positive cancer can grow quickly because it has all of these receptors which increase growth, and that is true. However, triple positive are very, very responsive to treatment. So even though they grow kind of quick, they are ones that you can actually treat more easily.
Okay.
And so, the opposite in the spectrum would be triple negative, where it's ER or estrogen receptor negative, progesterone receptor negative, and HER2 negative. These are the worst prognosis. These are the ones that you see with like the BRCA, which is the gene abnormality thing where people are really prone to get breast cancer young. So that's not a good thing. And then of course there's everything in between, because you could be like ER positive, PR negative, HER2 positive.
So it seems like the word positive means positive result usually. Like
it's better to have positive ones.
Yeah, it's easier to have a positive result with treatment.
Yes,
because and then the negative is like
because
you can treat it, but it's not going to.
There's medications that'll block those receptors, and so those cells with those receptors tend to grow because of the hormones that are hitting them, and you can block those. So it helps to kill the cancer. And knowing the status of those hormone receptors, which is really what I just said, helps both in knowing the prognosis and also in directing treatment. So that's a little bit about like stage and like the hormone receptor positive negative discussion. You'll hear that a lot. People say, "Oh, I have like a triple negative cancer, I have triple positive cancer," or whatever. And that's what that means. It's talking about the hormone receptors on it.
Okay.
And as I said, it gets a little confusing because there are ones that are positive and negative, and then like there's different little subtypes for that. But just kind of knowing the basics, I think, is enough for most people. Obviously, if you had breast cancer, you would do a deep dive into what exactly is mine and like what does that mean. But just kind of knowing the basics, I think, is helpful for understanding people. Like when she's talking about that, it's like, oh, okay, I know she's talking about the hormone receptors of her tumor, and that's generally, even though it can grow faster, it's a good thing. And the last thing I want to talk about specifically to her, which I think is really, really important, is the fact that when she got her mammogram, they said that she had really dense breast tissue and that they needed more studies.
Yeah.
Dense breast tissue is very common. So basically a breast is made of fatty tissue, fibrous tissue, or glandular tissue. And so a fibrous breast is one that has less fatty and more fibrous or glandular tissue in it. And it does increase your risk of breast cancer, and it also makes it harder to interpret mammograms because they can't see those telltale signs of cancer that they're looking for.
It like kind of makes it cloudy. Almost.
Yeah, fill up the pic. You're gonna like this pic. There you go. So the left one is fatty. The second to the left is called scattered. So these are basically different stages of how dense a breast tissue can be. The third one is heterogeneously dense. I failed that one, Travis. Sorry, man. I let you down. And then the last one would be extremely dense. And so you can see anything that's on an X-ray that's white is denser. So the very left picture is like the least white. And then as you go through them, they get whiter because they're more dense. And so if you're a girl, and fibrous breasts are dense breasts are very, very common. If you have dense breasts, it's definitely important to get your mammograms because it's a slight increase in risk of cancer. And if your doctor says, hey, we got the mammogram and we're just not sure about something, like, don't blow that off. You know, Jenna Fischer's story is a classic example of, hey, your breast tissue is too dense. We need to get another study, and it might have saved her life because she did that. I think most people would do that, but, you know, some people are really reluctant to get mammograms, and I could see some people like, oh, I got my mammogram, and they, you know, they said they can't tell, and they want to order another study, and maybe they're just trying to run up the bill. No, like, it's important. So if you have dense breast tissue, then
well, it's cancer, so it's pretty important.
It could be cancer, yeah. That's what we're looking for, yeah. But yeah, interesting stuff from Jenna there. So, all right, let me recap that one, Travis. I just wanted to kind of go over the segment we were talking today, which is Pam Beesly from The Office, Jenna Fischer, the actress, just came out on social media and said that she was diagnosed with breast cancer about a year ago, but now she is cancer-free. And there's a couple interesting things about her story. She talked about how important it is to get mammograms, and I absolutely 100% agree with her. Breast cancer is absolutely curable, but you want to catch it early, and mammograms are far and away the best way to do that. So get your mammogram starting at 40 years old. Talk to your doctor about it, like when you should start, but generally around 40. The other thing that was interesting is she talked about her type of cancer being stage 1 and triple positive. Basically, in a nutshell, stage 1 is a good cancer. It's stage 0 through 4, with 0 being the best and 4 being the worst. So 1's a good one, means that it's definitely treatable with a good prognosis. She talked about being triple positive. That talks about the hormone receptors on the tumor, meaning if it's positive, the tumor responds to hormones, which means it can grow faster, but also responds well to treatment. So and then lastly, she talked about that she had to get further studies because she had really dense breasts. I think that's an important thing to know too, because so many women have dense breasts, and it sometimes means that reading the mammograms is harder and you might need more studies. And if you do, go get them, because having dense breasts is a increased risk of breast cancer. So a couple of really interesting things to know about Jenna Fischer and her breast cancer diagnosis. I'm so glad that she's cancer-free. I wish her the best because I love The Office. And Charles is going to start watching The Office, he told me.
I definitely will. I definitely will.
Definitely will.
I have to find which streaming platform it's on.
All right, let's move on to a segment that I'm going to have to give people warnings about because we've got some pretty crazy photos. I don't want you passing out on me, Sarah.
What is it?
Have you guys heard of Hidradenitis Suppurativa? Yes or no?
No. Why are we looking at armpits?
Oh, yeah, there it is. So as I normally do, sometimes I come up with segments based on patients I see. And I recently treated the absolute worst case of hidradenitis suppurativa I've ever seen. It was a really drawn-out process, and the guy was very, very thankful. I got this guy actually in a really good spot, and he was very thankful, and I asked him if I could use some of the photos I took, and he said absolutely. And so I thought I'd do a segment about it. So I think we did a segment one time on consults as a plastic surgeon that I don't like to get. Mm-hmm. I think I may have mentioned this disease in that.
I don't remember.
I don't remember either. I almost went back and looked. I remember thinking about it, and I don't know if I did. And the reason for that is hidradenitis suppurativa is classically a very, very difficult thing to treat.
Is it like an infection?
Yeah. So it's also called acne inversa. It's a disorder of the skin in sweat-bearing areas that have apocrine glands, which are basically sweat glands. Okay. Which means that it's mostly focused in like the armpit and the groin area. Uh-huh. That's where you see hidradenitis suppurativa the most. Happens in otherwise healthy adolescents and adults. Typically doesn't happen in kids prior to puberty. The pathophysiology behind it, it's basically when the hair follicles get occluded and then they rupture, which allows a lot of bacteria to get into the skin. And so how that manifests, like when it starts, it will it'll come up as like a red area, either in the armpit or the groin. It'll progress on to these really painful bumps. Uh-huh. And then it goes from there into draining pus. And it can be absolutely foul. I mean, it can be bad, bad, bad.
Yeah. Doesn't sound good.
It's not a good thing. It's a genetic thing. You know, it's seen from if parents have it, then their kids are very likely to have it. I think it's autosomal dominant, which means it's like a 50-50 if your parents have it, whether or not you get it. Mm-hmm. The problem with this disease is it's not like it pops up once and you treat it and it goes away. It's recurrent. It keeps happening, and it can happen, pretty continuously. And this can be like absolutely life-altering to people. There are some people that have it in a minor way, and they'll get a flare-up, maybe every year or two, and they treat it with some antibiotics or other treatments, and it goes away. And then there are people like the patient I'm going to talk about here at the end, where it is crippling. Like the pain is severe. It starts to affect the range of motion of their arm. Throw up that second picture, Trey, if you can. Yeah, that. So that's basically a healed hidradenitis suppurativa, and you can see there's a lot of scar tissue there, and that starts to affect the joint. When you build up enough scar tissue in the armpit or the groin, it starts to affect how it works.
Yeah.
And so the other thing is, when they start draining pus, I mean, it's not just a medical problem; it's a social problem. I mean, there's like odor, like your clothes are getting, pus on them. I mean, it can like absolutely shatter your life. The risk factors would include things like smoking, obesity, and trauma to the area. There are treatments for it, but the non-surgical treatments are lackluster. It's things like, pain medication to control the pain, antibiotics, whether they be topical on the skin or oral. A lot of these people that have this get on basically lifetime antibiotics to try to keep the infections from flaring up.
That's not healthy.
No, not good. They sometimes have to take steroids. There's other drugs, adalimumab. I can barely say that.
What about like laser hair removal to like kill the
follicles? Yeah. I haven't seen that as being like a super effective treatment, although it would make sense. I haven't personally heard of people trying that.
If I like was
That's
a
a good
mom,
point,
if
though.
I was a mom,
Like, yeah, that sounds right.
as soon as if I started seeing that like that type of skin issue with my child, I would immediately
laser hair removal.
laser hair.
I don't know. I think
if it has something to do with hair follicles.
Yeah, you're right. Man, I'm not sure if that works or not. That's a great question. I don't remember seeing that like in the treatments.
Because that's like it's almost like it's like severe razor burn. Like a little girl, like a teen, like a girl, she won't be able to shave her armpits probably.
Oh, absolutely not.
Nothing.
I mean, it's way beyond that. I'm gonna have to look that up. I want to say that hair.
That is so.
I want to say laser hair removal doesn't cure it because it's also related to like the sweat glands, and so I don't think that is effective. I haven't heard of it. But that's a great question, though. I love when you pull these questions up.
Yeah,
Like,
I was just thinking about it, and then I also think about. I remember one of my friends. She insisted that she had like an overactive like sweat gland, so she was.
That's
like,
a
sweating.
real thing.
Yeah.
Hyperhidrosis.
I mean, I'm a sweaty girl.
Hyperhidrosis.
And I'll admit it, but
Are you?
yeah, I get hot so easy.
Oh.
I'm like always hot. She would go get shots in her arm, like her armpits. Yeah, is Botox in her armpits to make her stop sweating as much? Interesting.
Yeah, you can do that. Yeah, Botox, it will cure hyperhidrosis. I've never actually done that for anybody because unfortunately insurance won't cover it, so you have to pay out of pocket and you have to use a lot of Botox, and so, but it does work. So
Interesting.
How do I get involved with this? Well, I get involved with this because this can make horrible wounds and it can require reconstruction to fix. So when people get this really bad, a lot of times they'll need surgery at the very least just to open up the abscess pockets, because if you have channels of pus in your tissue, whether it be your armpit, your groin, or elsewhere, and it's not going to heal unless you open it.
Yeah.
So a lot of times, surgeons will get consulted for hidradenitis, and if they're not plastic surgeons, or even some plastic surgeons, they're like, look, I'm just going to get you over this, that's all we're going to do. And they'll open up the abscesses, let them drain, wash them out, and then it tends to resolve. But it's not curative. It just comes back. So I try to do curative treatments. The only thing about the curative treatment is it's kind of intense. It basically, you have to excise every bit of skin that has that issue, and then you have to skin graft it. And that's a big deal. And so we usually only save that for the people who have like the really, really bad cases of hidradenitis. So that being said, let's jump into this. Now, trigger warning, these pictures are a little graphic. If seeing like wounds is not your thing, you've been warned. All right, so I get a consult. My buddy in the ER calls me and said, look, I got a bad hidradenitis. And I'm like, okay, I've seen some bad ones. So I go on out and look at this thing, and wowza, show up that first picture. So this is hidradenitis. This one is so bad that the infection killed most of the skin in his armpit. And Sarah's face, I know, Trey. Trey's laughing in the box at Sarah's face right now. The infection was so bad that it basically rotted most of the skin of the armpit. And you can see that there's pus along the outside, and you can see that bumpy skin around the wound is also affected by this. And this is the worst I've ever seen. I've seen people get some skin necrosis, but not to this degree.
Can I ask a question?
Yeah, of course, man.
Can that spread further than that region?
Yeah,
or does it
not usually, man, because it is localized to areas that have sweat glands.
It looks like he just got like
Attacked by
shot in the armpit.
Yeah, it's
It
pretty
looks like
rough.
he's like.
I mean, this guy was in a ton of pain. Like, he was miserable. Like, I mean, not to be like gross, but like there was so much pus that like the odor was overwhelming.
Death.
Yeah, it was pretty bad.
Well, it looks like he has it seems to me like just like looking at the other parts of his skin, it's like people that have like body
Oily
acne.
skin. Yeah, he's got some oily skin issues. Yeah, for sure.
Yeah.
For sure. Because he's got some other like spots, like not the hydradenitis, but you can see that he definitely has some like,
like body acne,
Yeah,
like
some body
people
acne,
with
yeah.
that type of skin.
So what
Are
to
more
do
prone
with
to it.
this? The first thing I did is start him on some really aggressive wound care regimen to try and tamp down the infection just in the meantime before I get him to the OR, which really only took, I think it was the next day that I took him to the OR. So next pick is after the first debridement. And so this actually is much better, but you see the wound's much bigger because I took out all of the skin
yuck.
that is
Dead
that can be
stuff.
affected by this, because I was like, look, dude, we're not just gonna like get the infection gone. We're gonna treat you and we're gonna cure you, and it's gonna take some time. And I told him that, and he's like, I'm on board. So I took off all of the affected tissue, took some cultures so that the medicine doctors could give him the best antibiotics, and then I started some dressing changes. And then he was having some rough time with the dressing changes, so like a few days later, I'm like, look, I'm gonna take you to the OR. We're going to clean this thing out again really good. We'll take some cultures, and I'm going to put a special dressing in to try to grow some tissue. We're going to leave that on, and then we're going to skin graft you. So go to the next pick. So this is the second trip to the OR. Now, I'm sure for you guys it's going to be hard to tell, but I can look at this wound and tell you that that's an improvement from the previous one because I can see the new tissue growth. It looks like, if you really look close in the picture, you'll see this kind of bumpy characteristic to the tissue, almost like it's rough like sandpaper. Uh-huh. That's called granulation tissue. That's new tissue growth. So we have a wound now.
It looks better on the outside.
Yeah.
It doesn't look as like inflamed.
Yeah. Oh yeah, definitely the infection. And I recultured him. The first culture obviously came back, very, very positive. The second culture I took at this time came back negative. So I was like, all right, we got some new tissue growth. We got a negative culture. I think we should go ahead and skin graft you. Now, he's been in the hospital this whole time. So we're talking like, a couple weeks at least he was in the hospital.
Gosh.
So I took him back to the surgery again, and this time I did a skin graft. Throw up that next pic. Okay, so I didn't take a picture of the graft after I put it on because I just got really involved with actually doing the surgery. But this was 5 days after I put the skin graft on. And so you can see the skin graft. It looks like mesh.
Yeah.
Like, you can see it best in the center where it's white. It's like that everywhere, but on the outside, what has happened is when I took the dressing off, like it bled through the skin graft, which is super, super common. So there's a little bit of blood on top of the skin graft, but the whole thing is skin graft. And I'll tell you, skin grafting an armpit is challenging because it's just a very awkward area to like try to work. It's hard to keep the dressings on, but this skin graft did awesome. Like this was, I wouldn't say it was 100% take, but it was like a 95 to 97% take, which is outstanding for an armpit. And so we started doing some dressings to him, and then I got a pic about was like maybe a week later. Now the skin graft is, so I know the angle's kind of odd because I was trying to take a picture up in there and show it. But you can see now that skin graft, which didn't necessarily look like skin in the last picture, is now actually starting to look like skin.
Yeah.
And you can see that it's almost 100% covered. The one area that didn't take the best is in the far right. You can see a spot where there's like a couple of like maybe dime size areas of red without graft on it. And so we did lose maybe 1 or 2% of the graft, but that's fine. Those little areas will fill in quickly with the skin that's surrounding. But yeah, in the span of 2 to 3 weeks, I took this guy from a problem that was so bad that he couldn't leave his house, that he's also had for almost a decade, and we cured him. And so that's cool, man. I mean, I like that, and there's not a lot of people that
So he's not going to get that stuff again?
Not there. He can get it in his other armpit or in his groin for sure.
Dang.
But I told him, like, hey, if you want to tackle, every area, that's fine. We just got to do them one at a time. It's just too much to try to do multiple at the same time.
Yeah, that's definitely something you just like shave off some skin pretty much, like a layer of skin.
Honestly, most of the work kind of was done for me in this case because the infection was so bad it just outright killed the skin. And so, it's a big deal. I mean, it's a big surgery. I mean, the guy was in the hospital almost 3 weeks.
That's a big bill.
Yeah, I mean, that's what, you have insurance, I guess.
Yeah.
I mean, I don't get paid a lot for doing that. I mean, I probably will get for, like, all treatment of that from insurance, it'd probably be less than $1,000, I'd guess.
Really?
Yeah, it's pretty low. Like the debridements that I did pay nothing, like maybe $100. Skin grafts pay okay, but not a ton.
When you do a skin graft, is that just like basically pulling skin from somewhere else on the body and placing it there, or?
Yeah.
I think you've talked you've had.
Yeah, we should do a segment on skin grafts.
I think you did a segment on.
Did we?
Skin
I can't remember. Basically, there's 2 types of skin grafts. There's split grafts and full. So split graft is where you just take a very, very thin layer of skin, so thin that where you take it from heals like in a couple weeks. And
you showed us the machine.
Oh, I did. Yeah. Cool. We may have to do another one.
It's like a little.
Yeah, it's like a cheese grater.
Cheese grater.
Right.
You remember
Yeah.
that?
Sure did. Yeah.
Yeah.
We may have to do that. It's been a couple years now. We probably should repurpose that one. But yeah, I just took the skin from the top of his leg and then grafted it onto that wound, and then you put a special dressing over it, and they heal pretty quickly. Skin grafts are pretty reliable. I did tons of burn surgery when I was in training, and so it's just something I have a ton of experience with. I've done like 4 skin grafts in the past month for various reasons. I mean, that's kind of a busy month for skin grafts, but yeah. So he's basically healed now, and he's really happy. He was like, yeah, man, you can definitely use my picture. So all right, I'm going to recap this one real quick. Today on our Nip Talk, we were talking about Hidradenitis Suppurativa. It's kind of a somewhat rare disease where people's sweat gland areas get really, really bad infections. And, this is a genetic thing that can be, in the lighter, less serious cases, annoying, but up to the more severe cases be like life-altering. It affects the armpits and the groins the most, and people have these recurrent infections with these painful welts and draining to pus, and it's just really kind of a bad disease, and it's hard to treat it, honestly, with medicines. It tends to keep being recurrent, and people are on antibiotics for their lifetime, but it still happens. So, as plastic surgeons, we can cure this. It involves resecting that area of all of the skin that has the problem and then skin grafting it. And we talked about a case I did recently where we did that, and it was some really kind of interesting, cool pics if you like that stuff. So if you want to check that out, then check out the full episode. So, all right, moving on, last segment.
What do we got?
This one's kind of interesting. It's something, again, that pops up in my practice, and I was like, oh, this would be a good topic. And we may have talked about this. I was trying to remember last night if we ever talked about it. So if we have, tell me. So this is a segment talking about what plastic surgeries might be covered by insurance.
I think we have.
Have we done this one?
Yeah.
I mean, if we have, oh my God. It'll be fun. All right, we're going to do the segment, but then I'm going to watch it.
Let's see if this one is better than the other one.
I know. I think maybe since we did, I can't believe it.
I think we did it.
Did we?
I think so.
It must have been a long time ago. I bet we have new followers since then.
Absolutely.
So they're probably going to
reiterate and go back over again. It's all right.
Well, I mean, and this is a good one that, it might be worth revisiting from time to time because it changes, year to year.
Yeah.
I get tons of people calling my office asking if this particular plastic surgery might be covered by insurance. And, like, the general answer to that question is no.
Yeah.
But not always.
Yeah.
Obviously, things like reconstruction for trauma, reconstruction for cancer, those things are always covered.
Yeah.
Without question. The surgeries that I'm talking about are the ones people classically think about with plastic surgery. Things like, can I get my tummy tuck covered by insurance? Can I get, my breast reduction, my eyelid surgery?
I can see breast reduction if it's causing like medical issues.
Yeah, man, that is the very first one that we're going to talk about. But I do have a very, very important point that I'm going to make because the first one I was going to talk about was breast surgery.
Okay.
And this is important. And so if you take one thing away from this, this might be worth taking. If you have ever in your life had a diagnosis of breast cancer, okay, you can, from then on, get any breast surgery you want covered by insurance under the umbrella of reconstruction. So, for example, we talked about Jenna Fischer earlier, and she had a lumpectomy, which means they took just a small piece of her breast out.
Yeah.
Chances are her breast looks completely normal, okay?
Yeah.
If she wanted to go and get a breast augmentation surgery right now, she could do that, and it would be covered by insurance because it would fall under the umbrella of reconstruction of a breast that had cancer.
Okay.
If her breast had, sagged after, I mean, not just her, but anyone. I mean, if you had sagging with your breast and you wanted a breast lift, you could get that covered by insurance under the umbrella of reconstruction.
That's good to know.
Yeah, it is good to know. I mean, I guess if there's ever a silver lining about having a breast cancer diagnosis, I mean, obviously getting cured is most important, but having the ability to get your breast altered to your liking is not a bad perk, I guess. Now, what if you haven't had breast cancer? Okay,
Yes.
That's the question, right? So someone calls up, and I don't have it, no, I've never had breast cancer. Can I get my breast surgery covered by insurance? Breast reduction. Historically, breast reduction was covered by insurance. When I started my practice in 2010, I was doing like 3 breast reductions a week through insurance.
Yeah.
It was very easy to get them covered because just like you said, patients can have neck pain, patients can have shoulder pain, patients can have back pain.
It can interfere a lot with just if you want to go running.
Oh, absolutely.
If you want to
100%.
be
Do
more
anything
active
athletic.
in your life. Yeah.
Absolutely. And so historically it was very easy, and every year it got harder and harder and harder to get these covered by insurance. And now I don't want to say it's impossible, but it's almost. In fact, we have quit taking insurance for breast reduction, not because we've quit taking insurance, but what really was the straw that broke the camel's back for us is we had a couple times kind of right there at the end where we were doing these under insurance, where insurance would approve the surgery and then they would deny to pay on the back end. And that is a huge problem because we generally
scary.
will eat it, meaning we won't go after the patient for money because it's
Not their fault.
It's not their fault, and it's not good business to have patients that are unhappy because you're going after them for money.
Yeah.
But the thing is the surgery center doesn't care, and they will absolutely come after the patients for the money that the insurance didn't pay. And we had patients that were super unhappy, and it's not our fault. We did the right things. So if you talk to your insurance company, they will say breast reductions are covered. It's pretty much a lie because they either make the requirements just unobtainable, they will say that you have to take off an amount so large that you would have no breast tissue left, which no one would agree to, or they set up so many roadblocks, you have to have 6 months of physical therapy that failed and all these things that no one's going to do, or they'll just say that they're going to approve it and then they deny it on the back end. So, I consider breast reduction one is 99% you're not going to get it covered, even though that's criminal. What ended up happening, just to kind of get some background, of course, insurance companies are always looking to save money, but it was getting abused slightly because, part of a breast reduction is doing a lift.
Yeah.
And there's a lot of women who want to lift cosmetically, and they said, well, okay, maybe I'm a D cup, but I'd be happy being a small D cup, just do a reduction, a tiny reduction, and lift my breasts, and insurance pay for it. And I think it was getting abused a little bit. And so insurance companies basically quit doing it. So breast lift would be the next one. Basically, no, never is insurance ever going to pay for a breast lift, with the only exception being if it was after cancer diagnosis. Augmentation, 99% no.
Yeah.
The only time that I've gotten insurance to pay for breast augmentation outside of cancer was for congenital breast deformity. So somebody that was born without a breast. So that would be there's a syndrome called Poland syndrome, which is basically this syndrome where you don't have a breast on one side. I've done a couple of...
What about if one's one breast is a cup size bigger than the other?
I mean, unless there's a congenital deformity, the breast just isn't formed. If you just have one breast that's larger, insurance is not going to pay to put an implant on. Yeah, they're pretty strict. Sucks. Breast implant removal. This one's a maybe. If you had a breast implant that got infected and was making you sick, and you went to the ER, insurance would pay for you to go to the ER or to the operating room to remove that breast implant. But the problem is they would not pay to do anything else. And if you remove an implant, you are almost guaranteed to need a lift, or your breast is just going to look like a deflated sock.
Yeah.
And so nobody wants to do it like that. So.
Well, I can see that they pay for to fix the problem.
Yeah. Yeah.
But not to fix the problem.
Yeah, and that's only if it's infected. Like, say you had like a ruptured implant.
Yeah.
You know, insurance not going to pay to fix it unless there's some emergency. You know, it's pretty crazy. So abdominoplasty. No, but in the past, maybe. There is a procedure called a paniculectomy, which is where you remove excess skin at the lower abdomen. It's one of the 3 parts of a tummy tuck, with paniculectomy, liposuction, and then abdominal wall repair being the 3rd. In the past, like when I started in 2010, we sometimes could get people's paniculectomies covered, and then they would pay the difference to have a full tummy tuck. That was actually a pretty common thing that was done. And then insurance companies kind of figured that out, and nowadays it's basically impossible. The only paniculectomies you can do are like the more reconstructive ones. Like, say somebody started out at 600 pounds and they lost 300 pounds, and they're down to 300, but they have this huge overhang of skin which prevents them from walking. I mean, I've had patients. The biggest paniculectomy I ever did was 45 pounds of skin. That was insane. It was huge. You sometimes can get those covered, but those are not the person calling up my office asking if they can, get their tummy tuck covered. Yeah. The other one is eyelid surgery. Upper eyelids. Well, think about it this way. As the upper eyelid skin gets over redundant, it starts to occlude your vision. Oh, okay. And it becomes a medical necessity. You can still get upper eyelid surgery covered by insurance. It's gotten more challenging. They've thrown up roadblocks. But if you truly have eyelids that are occluding your vision, then there is a chance insurance will cover that for sure. I've done a couple of eyelids. Nice. Yeah. The thing is when people call up wanting eyelid surgery to my office, mostly it's not that bad. It's just that their eyelids are kind of redundant and it's making them look older, and they just want to fix it. Mm-hmm. If it's like mild like that, yeah, no chance. Literally the eyelid skin has to be drooping over your eyelashes where it's like starting to shroud your vision. Yeah. In which case insurance would cover.
Travis, now you know.
Did Travis was saying you want eyelids done?
Yeah, you know me. Me and Sarah was having that conversation before the show, and we had that conversation.
You guys were talking about The Office and talking about how you want to get your eyelids.
We had that conversation in confidence, so now the world knows.
Just too late. Sarah, whenever you need those eyelids fixed.
I got you, bro. You want that done? I will hook you up, man.
I appreciate it.
Yeah, no problem.
I appreciate it.
Gynecomastia for men. This is one that you can sometimes still get covered. It used to be a lot easier. So gynecomastia, I know we've talked about this. That's where men get like female breasts. Mm-hmm. In the past, it was kind of easy to get that covered. Now it's pretty hard, but not impossible. It just really depends on the policy. Some policies are okay with it. Many are not. So possible, but we do a lot of gynecomastias out of pocket these days. And then the others: liposuction, arm lift, thigh lift, facelift, neck lift. Never, 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 never. You cannot get those covered by insurance.
Can you get Botox on insurance if you have like severe migraines?
So allegedly, I can't get it because I tried that because we had a few people call wanting Botox for migraines, and the short answer was because you're a plastic surgeon, we don't trust your judgment to say that someone needs it for migraines. It has to be a neurologist.
Yeah, see, that's what my neurologist, whenever I used to go to one, because I had a seizure a long time ago.
Yeah, I remember you telling me about that.
Yeah, they asked me if I wanted to have Botox to treat my migraines, and I was like, I really don't have migraines, and they're like, you sure?
Yeah, right.
You don't want? And I was just
Never had a migraine?
And I was in my 20s, and I was
you
like,
didn't know.
Yeah, I'm sure. Like, I don't want to get shots in my face just for no reason.
And now,
but I'm sure you have to I'm sure it's not like, because you typically, like, whenever you do it like in that like the triangle thing.
It's a little bit different. Yeah,
and for migraines,
it's more probably, like it's more in the forehead area and then going back.
Yeah, it's not for
it'll help
aesthetics.
It'll help because if you knock out some of these lines, which I'm starting to get them here, my office manager keeps telling me I need to get Botox. I may try it.
How rude.
I know. Yeah.
I'm just kidding.
They're so mean to me. But, Botox is a tough one. If you really do have bad migraines, you can go to a neurologist, and there's a chance that they...
And they put the shots, like, all the way in your hairline?
Ah. Yeah, the thing is that it's hard to do that one out of pocket because it requires so much Botox, and it's, if you were paying for it out of pocket, it'd be, like, over $1,000. Because I think it's 120 units. Because typically, a I think when we did yours, we did like 50, which is a, average dose. 120, I mean, cheap Botox, $10 a unit, so you're talking $1,200. So it's kind of pricey unless you get insurance to pay for it. But I'll tell you, you were talking about this earlier, that, one thing that's nice about Botox is even getting it for cosmetic reasons dramatically decreases headaches. Would you not agree?
Yeah.
Yeah.
Especially like I don't know what type of headaches they're called, but it's just like from like muscle
Tension.
strain. Yeah, tension headaches. Yeah. And I think I get those the most.
I had to reach back for that.
Yeah. It hurts. Because I have a problem with like scowling. I was just telling him, like, I think my head started hurting because I was like scowling when I was driving, and I don't even notice. Like when I concentrate really hard.
Right, dude. Well, you got to concentrate in Dallas traffic.
I know, because or else you're gonna.
It's like a Mad Max episode out there, I mean, it's killer be killed.
Wild.
Dallas traffic is real, man. I've lived in a few places and like
angry driving.
It's angry and it's fast. Like I swear to God, I was on my bike the other day and I was doing like 90 miles an hour, which I know is not necessarily safe, and people were like passing me on my bike. I was like, in like minivans. I was like, what's going on?
I had to get to Chick-fil-A.
Dude, Dallas traffic is bonkers, man. It's like 100 is not out of the realm of normal. Would you guys agree that 100 is not out of the realm for normal drivers in Dallas?
Yeah.
I'm not talking like people racing. I'm talking like dude going from like home to work or lady going to wherever, like 100 miles an hour. Like
driving in Dallas is not for the weak.
It is not for the weak, man. It's wild out there. All right. I think that's all the time we got for today's episode. Please leave us a comment. We want to hear from you. If you have any topics you'd like us to cover, we would love to cover them. So drop us a comment in one of the social media things. And otherwise, we will see you guys next week on Nip Talk. Sarah?
Bye.
Bye.